Hey, I'm sure most of you guys have visited the dentist before, but not everyone is really comfortable with the idea of going or even know the procedures that take place in the dental office. So, one procedure that takes place at the dental office is the dental implant. What I'll be doing today is describing to you how I would design my first dental implants. So my name is Kemore Henry, and I'm going to actually start off by allowing you to see exactly how my design looks. Then I'll go through a step-by-step procedure and show you how I got that design. So basically, a dental implant is a surgical fixture that is placed onto the jawbone and allowed to fuse with the bone over the span of a few months. The dental implants acts as a replacement for the root of a missing tooth. In terms, this is actually an artificial tooth root. This actually serves to hold a replacement tooth or a bridge. So my patient is a 43-year-old male who was recently in a car accident which resulted in the loss of both maxillary central incisors, as you can see. So look on those pictures, look on the radiograph, and here's how I actually designed my dental implant. But first, I'm going to ensure that I took an accurate medical and dental history to ensure that my patient had no contraindications to treatment, and I ensured that I knew what type of allergies they may have to certain materials or previous ailments that they may have had. Dental implant material. I choose titanium grade 5. The reason for this is titanium is a biological inert, corrosion resistant, and forms titanium oxide, which separates the titanium from its surrounding and promotes osseointegration. Along with that, the film which is produced allows for good biocompatibility. Now the choice of the grade 5 is due to the strength above all other grades. Also, grade 5 is 78% stronger than its previous grade. That was dental implant material. Now the outside thread design. The outside thread design has different components. The thread pitch is 0.8 millimeters thick. This increases the surface area, allowing greater stability with more of its surface in contact with the oral cavity. You have thread shape. The type of force applied at the implant bone interface may influence the degree and strength of osseointegration. The type of force that is generated depends on the shape of the implant thread. Hence, an ideal implant thread design should provide a balance between compressive and tensile forces while minimizing shear force generated. I choose the square thread design because it has the least shear force generated and it has a balance between compressive and tensile forces. Thread depth and thread width. Greater thread depth causes greater surface area. Greater thread depth may be an advantage in areas of softer bone as it causes condensation of bone and creates a relatively denser lining along the implant surface, and in areas of higher occlusal forces because of the higher functional surface area in contact with the bone. The thread depth that I choose is 0.5 millimeters. This reduces the peak stress concentration within the bone, and the thread width is 0.3 millimeters. Now let's move on to the body geometry. For the body geometry, I choose parallel body to distribute the stress and provide more surface area. So the surface treatment now. In order to increase surface area, I wish to use laser ablation, where high intensity pulse of a laser beam strikes the surface of the metal and coats it in a honeycomb pattern with small pores. Implant length. I choose the implant length of 12 millimeters since the bone remaining in the maxillary arch is 14 millimeters long. I wish for a greater length to increase the surface area of the implant, to increase osseointegration, changes, and retention. Now the implant diameter. The implant diameters that I've chosen are due to how the tooth were inside the bone before. There are different diameters at different areas. I chose to actually reduce the dental implants diameters by 1 to 1.5 millimeters accordingly to allow for different working space and also different factors which may be within the occlusal socket inside the mouth. So the mesial-distal diameter of implant crown is 7 millimeters. Mesial-distal diameter at implant cervical line 5.5 millimeters. Bear in mind that these are the reduced numbers. So before, the mesial-distal diameter was 8.5. Now let's carry on. The labial-lingual diameter of implant is 4.5 millimeters. These are the diameters which I would use for my implant. Now, the choice of dental implant diameter depends on the volume of residual bone, the amount of space available for the prosthetic reconstruction, and the emergence profile, and the type of occlusion. In cases of lower bone quality, the optimal increase in the implant length and/or diameter should be considered to achieve higher primary stability, measured as implant stability quotient. These are all adjacent, so these were all measurements that I had taken before and scale them down as I've told you now. Enjoy these pictures. These are how the actual diameters and the varying lengths would look. Now let's move on to the internal hex. Now the hex design which I chose, the abutment index that I chose is internal hex. Here are images of the internal hex. Now why I choose internal hex is because of high initial stability, bone preservation, aesthetics, safety, and clinical success. Now on each of these points I've elaborated on the PDF document that I submitted, and I also have varying notes on why I actually chose these designs. Now for the abutment screw, I choose the abutment screw with a screw, so if I had to actually do replacement or fixing, it would be done easily if it had a screw. It can be multiple hexagonal coated with titanium nitride to reduce friction. A replacement 30 cm abutment screw will also be used specifically. Now lastly, the abutment material. I choose titanium material for the strength in the restoration and for aesthetic concerns as well. These abutments can also be coated in gold and/or made of ceramics to minimize the gray shade of titanium. They may be showing through the gingiva or showing through all of the ceramic crown. Now, thank you for listening. Thank you for allowing me the time to show you this presentation. Please enjoy these other pictures, and I really hope that you enjoyed my presentation overall. Thank you, Dr. Brady, for giving me this assignment to allow me to actually learn more about dental implants. Thank you.